Friends, ladies and gentlemen, you all know there is a hue and cry all over the world about the pandemic conditions of mental health caused by corona pandemic. This is the number one health concern, mental health concern affecting millions of people all over the world. Why it is so? Coronavirus COVID-19 is a virus. As of today, scientists have not been able to determine exactly how it works, what are the structure they are trying. It affects human beings in the most serious way. Thousands of people have died. Thousands of thousands are in the hospital. Millions all over the world. In this country, United States of America, we have over 5.5 million people affected by coronavirus. This has caused serious stress, anxiety, fear of future, and that has led to depression. Let me talk about as depression has been the number one topic going on in the mental health field. When somebody is sad, it's a mood disorder. He doesn't feel like doing anything. He stopped enjoying the basic facts of life. Any enjoyment is a burden for him. He stops thinking properly. His attention concentration is low. He is preoccupied with death and dying, uncertainty of the future. And not only that, he also develops other physical problems. Like, for example, his heart might be beating faster. Sometimes he might have some problem of breathing. Sometimes he might have some problem of feeling okay to talk to somebody, to interact with somebody, and that leads to serious problems of the person, either not eating well, not sleeping well, have insomnia, have nightmares, and doesn't want to wake up in the morning because of the fear of facing the reality, and plans. If this severe depression goes on, if this goes on for some time, the person plans to kill himself because he does not see any hope for future. He feels or she feels that best way to save the family is for him to die by means of taking his own life or her life. And that has become a big issue after effects of coronavirus on human being. But there is a hope. There is so many things going on all around the world to help these people. But before I go into that, let me share with something that not everybody reacts to the same problem in the same way. There is so much individual differences in human being depending on genetic factors, environmental factors, and other factors, family factors, joblessness, unemployment, underemployment. And when you are locked down, you are continuously fighting with your spouse, child abuse, spouse abuse, violence, alcoholism, substance abuse, and other aspects of violence in the family. So depression might be one aspect of that, but violence is a part of also depression. Somebody might become more violent, somebody might attack somebody, and somebody might try to do something to others because they become paranoid. They think somebody is trying to do something damage to them. And that could be one of the reasons that we need to be safeguarding and do as best as we can to help these people with depression. Let me, for the viewers, give some tips how to find out whether somebody is sad or depressed. First thing happens, the individual loses interest in his personal hygiene. He doesn't brush his teeth. He doesn't change his clothes. He doesn't take bath. He just either sleeps or become restless. He paces. He cannot concentrate on anything. Sometimes they might eat too much food or do not eat at all. Somebody might lose weight, somebody might gain weight. These are some of the symptoms of depression. One more thing, when you know that somebody is depressed, there is a good chance he's thinking of committing suicide. That's the time a support system is most important. The family members, friends, and well-wishers must try to see that he does not buy any gun, any rope, any excessive alcohol, or tranquilizers. And that's the time you, the family members, must keep an eye on him or her that he does not get a chance to commit suicide. That's the time to talk to him, to get him out. Although unfortunately there is no movies, no restaurants, everything is closed. This has caused more problem, more depression, more frustration to the individuals. But still, we cannot lose hope. We have to have a hope for these people. You can call your own physician, psychiatrist, psychologist, social worker, and some mild tranquilizers might be very much helpful. Although I do not prescribe, I do not believe in tranquilizing individuals, but there are many other ways of solving the problems. I am amazed that during the coronavirus pandemic, there are so many gadgets have been in operation. You can get free almost every single day lectures from Sadhguru, Sri Sri Ravi Shankar, Baba Ramdev, how to maintain yourself by yoga, meditation. Many groups have developed singing, poetry reading, writing, gardening, cooking, as well as video conferencing, Zoom, communication with your friends whom you have not contacted for years, months. This is the time to contact them. It is the time to be connected. We are all social human beings. We need to be connected. We need to be with human beings. Without that, our life becomes very difficult. And this is what is happening. Let me give my own example. In the beginning, I used to watch television hours, and I developed high blood pressure. I called my doctor. He asked me, how many hours do you watch television? I say, almost every day. And at night, I used to have a nightmare, severe nightmare, sleeplessness. I used to dream that refrigerator trucks are full of bodies and nobody is there to say final goodbye. I was petrified. Once I stopped watching television, my blood pressure went down immediately. So reduce your television viewing as little as possible, because always you get bad news. Secondly, try to exercise. Even in my own home, I do exercise. If you feel uncomfortable going out, you can wear a mask in your own backyard, front yard, or if you do not have a front yard or backyard, you can walk outside. But exercise is very, very important. It helps reduce the stress. So there are many, many ways of handling our depression, sadness, anxiety, and fear. I am very grateful to Mrs. Nilima Mehra, executive producer of Global Television Network Fox 5, for giving this opportunity to share my views on this most vital, most important topic of the day: coronavirus, pandemic, and mental health. As I indicated, that there are many, many ways of handling this. But it is you, the individual person yourself, you have to take initiative. Unfortunately, when the person is depressed, he feels that he has no energy, he has no strength, he is always fatigued. So it is the family members, the support system, must come forward to help him. Many times, if he was taking some medications before, he thinks he is okay. He doesn't want to take medications. He doesn't want to go to doctor for the fear that they might find he's crazy. So, to help those people who are depressed, who doesn't want to help themselves, it is our job. It is job of the society. It is job of each and every individual, neighbors, friends, well-wishers, to come forward to help him or her. We don't want to lose a single individual. Suicide is a terrible thing, but it can be prevented. There is a suicide hotline. And also every county, every state has the mental health facility. So you can take advantage of that. You can contact them, talk to them, tell them your problems, how you feel. But you cannot wait too long. It can be too late. He might have already planned to take his life or her life. He might have already gone rope. He might have planned to jump in front of the train, etc., etc. So, hope is on the way. If you have any question, you can forward that to Global Television Fox 5, to Mrs. Nilima Mehra. Thank you for listening.